Welcome to this video, which is part of a series of trainings offered by the Midwest Center for School Mental Health, offering guidance for developing and implementing effective school-based mental health systems. My name is Dr. Cheryl Holm Hansen, and I serve as co-director of the Midwest Center. This training will share some general guidance for how to assess student mental health needs and how to use that information to drive decision-making about school-based mental health services and supports. Schools are not only an important place for students to learn, but they have also become the primary location for addressing mental health. Schools may offer a variety of mental health services themselves, or they may partner with community agencies to support mental health. They may also be helping to identify students in need of mental health support and offering referrals to community agencies. Resources are limited, though, and it's important that schools provide the most effective and efficient supports possible. But how do we know what services are most needed? What kinds of school-based services are the best ones to meet the needs of students? One pathway to answering this question is to conduct a needs assessment. On its own or in conjunction with resource mapping, needs assessment will help you understand what students in your school need and the best options for meeting those needs. This video will walk through the basic needs assessment process. I will cover several topics in this training. First, I will define needs assessment and talk about how it is valuable to school mental health decision-making on its own or in conjunction with a resource mapping process. Second, I will provide an overview of the needs assessment process itself, including descriptions of relevant best practice standards. So let's start with the question. What is a needs assessment? A needs assessment is defined as a collaborative process used by a system, such as a school, district, or agency, to identify strengths and gaps, clarify priorities, inform quality improvement, promote equity in services and systems, and advance action planning. This assessment should be collaborative and integrate available data and perspectives of a wide range of individuals who are part of or impacted by the mental health system. School mental health is intended to be personalized or targeted to meet the unique needs of a school or district. What works in a given community may not work in another community. A needs assessment can help a team design the best services and supports that are fitted to the needs at hand. There are 5 primary reasons why a mental health needs assessment is helpful. First, it can help a school identify the most pressing mental health concerns among students. The programs for a school with anxiety and academic stress as their biggest concerns would likely benefit from different services and supports than a school where depression and trauma are the greatest concerns. Second, a needs assessment provides the foundation for understanding how well services and supports are meeting student needs. Third, understanding strengths can help a team figure out how to use these strengths to help address gaps. Fourth, your needs assessment can help you identify and understand disparities in mental health needs and service access across diverse groups of students. Finally, your needs assessment can inform potential action planning and effective allocation of funding and other resources to meet student needs. Along with resource mapping, needs assessment is a fundamental component of the comprehensive school mental health framework developed by the National Center for School Mental Health. The comprehensive school mental health framework provides best practice guidance for developing and implementing school mental health systems. Recommendations are provided for 7 core elements of the system. HEMING addresses the need for a multidisciplinary approach for designing and implementing mental health services. Needs assessment and resource mapping are used to identify the most pressing mental health needs of students and available school or community services that could address these needs. Screening is used to proactively identify and refer students who may benefit from mental health supports. Services are provided at multiple levels or tiers. Tier 1 services refer to universal strategies that can be used to promote mental well-being of all students and to build healthy school climates. Tier 2 services refer to early intervention offered to students who may have emerging concerns or who may be at risk of developing concerns. Tier 3 services, in contrast, refer to the more intensive interventions offered to students with identified mental health needs. Funding and sustainability strategies are integrated into the system to ensure that needed services can be provided and sustained over time. And finally, a comprehensive school mental health system should include a strategy for measuring the impact of services and using impact information to continuously strengthen services, inform policies, and change systems. The Comprehensive School Mental Health Framework includes a variety of best practice recommendations that will be integrated into this training. This training was also designed to align with the culturally responsive, anti-racist, and equitable, or CARE, schools model. In a culturally responsive school, students, families, and educators' cultural preferences are included in all aspects of schooling, including supports and services that promote well-being and mental health. Policies and practices promote equity and oppose racism and other forms of oppression. Equitable schools provide the climate and resources that enable all students and educators to perform at their highest level. Culturally responsive and equitable schools embrace cultural differences and assets, use cultural knowledge to promote wellness and academic success, mediate power imbalances based on cultural identities, and work to dismantle systems of injustice. There are three distinct elements of this model. First, effective school mental health systems should incorporate cultural responsiveness, ensuring that supports and services reflect the cultural beliefs and values of students, families, and educators. Second, school-based mental health systems should actively and intentionally oppose racism and other forms of oppression. And third, school-based mental health systems should be used in service of equity, ensuring that every student has what they need to achieve academically and experience positive well-being. These values cut across all aspects of the comprehensive mental health system. We will see how these values relate to needs assessment as we consider whose perspectives are being reflected, what questions are being asked, and how information is being used to promote more equitable systems. This assessment can be most helpful when done in conjunction with a resource map. Resource mapping is a process of identifying available services or supports within a school or community that can be used to address identified needs or build on identified strengths. Having both information about student needs and available resources can greatly enhance your ability to select, plan, and implement school-based services and supports. In this video, I'm not going to talk in depth about the process of mapping resources. We do have another video in this series that promotes guidance specifically related to resource mapping. I recommend that you check that out and consider ways to blend your needs assessment and resource mapping process together. So let's talk through the general process for conducting a needs assessment. The details of the process can vary tremendously depending on the needs and resources of your school or district. However, in general, we recommend that you consider a 4-step process to conducting a needs assessment. The 4 steps include clarifying your goals and developing a plan, gathering and reviewing your available data, collecting additional information if needed, and sharing and using the results. We'll review each of these 4 steps in detail. It is vital that you take time at the beginning to establish your specific goals for the needs assessment. There are many different ways to focus the assessment, and it's important that your approach aligns with your local needs, interests, and priorities. The first stage involves a few key tasks, including convening your team, identifying the interests and priorities of your key stakeholders, confirming your specific goals for how you want to use results, and narrowing your scope to some priority topic areas. Ideally, an assessment is overseen by a core team that has the resources and authority to support both the assessment itself and the implementation of the recommendations. The planning team has a few key responsibilities as we move through the needs assessment steps that follow. First, the evaluation team is responsible for clarifying the purpose of the assessment. It's helpful to be very clear about what you are trying to accomplish, what you already know, and what you still want to find out. Second, the needs assessment team will determine the most appropriate assessment methods. They will consider what existing data you already have access to and determine which assessment tools will be used to measure student mental health needs. They will also need to consider how youth will be involved in the process, efforts already underway that should be woven into the needs assessment, and resources that can support outreach and data collection. Third, the team will develop an assessment timeline and strategy, considering questions such as, what is the timeline for collecting and analyzing data? What are potential barriers to engagement? What staff can we dedicate to support the data collection? Who will be responsible for each step? Once the data are evaluated, who will participate in developing recommendations and next steps? Fourth, the team will make sure that any necessary information is gathered and reviewed, either by the team themselves or by other partners. Fifth, the team will establish a plan to communicate the results of the assessment to key stakeholders. They will need to decide who will create the written report, who needs the results, and how the results will be shared. The Comprehensive School Mental Health Framework includes some best practice recommendations. One of these best practice standards relates to convening your team. Specifically, it is recommended that the team overseeing your needs assessment represents diverse groups, including parents, students, school and community health and mental health providers, school administrators, and school staff. It is important that the team includes representation from the diverse communities served within the school community. If your existing team does not include this representation, you may want to consider identifying cultural brokers to serve as liaisons between the school and the community. Cultural brokers do not need to be mental health professionals. They may be caregivers or family members with lived experience navigating the school or community mental health system. You may be able to identify potential brokers through local parent advocacy groups, community mental health providers, or health or school staff. The needs assessment team will play a vital role in determining the scope of the needs assessment and developing recommendations based on the results. To ensure that the process is transparent and equity promoting, it is recommended that all members of the team should engage in learning and reflection to increase their knowledge and awareness about their own cultural identities, their biases and assumptions, how culture and language influence the behavior of young people in the classroom, cultural factors that influence the expression of mental health issues, and social determinants that influence the health of the community. Before you begin work on the actual needs assessment, you should take a step back and identify the stakeholders who will be most interested in the results. For instance, are there others in the district leadership who are not participating directly in your team, but who will be responsible for authorizing funding or approving policy changes? In addition to identifying who these stakeholders are, it is valuable to take some time to ensure that you understand their interests in the assessment and to identify strategies for keeping them involved or engaged along the way. If you're not clear about their interests, you may want to have some specific conversations to figure this out before you move forward. You may want to create a worksheet, such as this one, to identify key stakeholders and document their interests. I found it helpful to describe not only what people want to know, but to also develop a plan for bringing them into the process. When and how should they be involved? What communication strategies work best for them? For instance, you may have board members who want to make sure that the assessment is successfully completed so that they can know the results when considering implications for budgeting. They do not have the time to be heavily involved, but would like periodic status updates and a summary of the results and recommendations. You may also have classroom teachers who have concerns about student mental health and who want to provide some input near the beginning of the process regarding their observations of students and information that might help them better support students in the classroom. They also do not have time to be deeply involved, but would like to provide input during the planning phase. Or you may have a school culture and climate team that is interested in the process. They may want to partner with you more deeply through the process to ensure that you have built in culturally appropriate assessment strategies, authentic and meaningful opportunities for parent and youth involvement, and a focus on equity promotion in the recommendations. You may want to meet with the culture and climate team regularly throughout the process, or invite someone from that group to join your needs assessment team. You are probably embarking on a needs assessment project towards a broad goal of strengthening your school-based services or supports. However, it's important at this stage to narrow your priorities down to your very specific goals. For instance, you may have goals related to selecting social emotional learning or mental health interventions, building community partnerships, increasing public awareness and support for school mental health, promoting equity and access to services, or something else. The details of what information you collect are likely to vary depending on these goals. Let's pause here for some reflection questions. As you embark on this process, do you have a team ready to take this on? Are all core perspectives reflected in the team, or do you need to expand representation? Are there critical stakeholders outside of your core team who will be interested in the needs assessment results? If so, do you understand these interests, or do you need to take some time to learn more? Do you have a plan for engaging stakeholders throughout the needs assessment process? Do you need any input from core partners on creating this kind of plan? Do you have specific ideas already for how the needs assessment results should be used and who wants to use them? It can be tempting to want to jump ahead into gathering information, but the importance of making sure you have this foundation in place cannot be overstated. Moving ahead without this clarity will significantly increase the likelihood that you gather information that doesn't fully match what is needed and limits your opportunities to use the information to improve services or supports. When identifying or developing a needs assessment, there are a range of topics that can be included. Having a mental health team that can help identify the topics of greatest interest will increase the likelihood that the information gathered is relevant and can inform the improvement of your school mental health services. You may want to know more about mental health needs, such as examining student stressors and mental health concerns, their awareness of mental health supports in school, or preferences for different types of mental health and wellness services, or the current usage of these available services. You may also want to explore feedback that students and parents have about current mental health and wellness services provided through the school. In addition to focusing on needs, you may want to build some strengths assessment into your process. An awareness of individual and community strengths helps to inform potential services and supports that would be of the most benefit. For instance, it may be helpful to document acts of kindness in school, positive role models, student, staff, and family well-being, or healthy relationships or behaviors. There is no shortage of potential questions to ask. The Center for Healthy Schools and Communities has some resources available that share potential questions that could be helpful to explore. For instance, you may have questions about the 3 tiers of supports that you are offering, the district's capacity to support student mental health and well-being, cultural responsiveness of services, school-wide responsibility for promoting student mental health or well-being, coordination practices, ongoing assessment of your mental health services or supports, district and school leadership, capacity building priorities, partnership opportunities, equity considerations, service quality, evaluation and continuous quality improvement efforts, or financing. That's a lot of potential questions, and they're offered just to stimulate brainstorming. No single needs assessment process can or should explore all of these issues. Instead, it's important to prioritize the questions or topics that are most important to explore in your own local needs assessment. A best practice standard from the National Center for School Mental Health is that you should focus data collection on determining the most pressing needs impacting the most students at each tier and assessing how well current services and supports are meeting needs. When determining what issues to prioritize, consider seriousness, frequency or extent of concerns, cost of the issue, feasibility of making an impact, the resources needed to make changes, school or district readiness to take action, or long-term impact or benefits. You would not want to invest all of your needs assessment resources, for example, in better understanding student mental health needs that are relatively infrequent, or that have a minor impact, or that are most easily addressed. What would help you take the most important steps in improving your school mental health services or supports? Once you are clear on the goals, you can begin to identify information that would help you answer your core questions. Before embarking on new data collection, it's advisable to start by looking at existing information that aligns with your priorities. This may include information collected directly by your district or information collected by other entities, such as mental health providers or community partners. Starting with your existing data is also a best practice standard recommended by the National Center for School Mental Health. Schools collect a lot of information already, so it's worth seeing if your questions can be partially or completely answered with existing data. Consider potential data sources, such as office referrals, expulsion or suspension rates, attendance and truancy records, nursing and counselor logs, incident reports, homework completion rates, school climate and behavioral surveys, rates of homeless highly mobile students, results of previous needs assessments, socioeconomic status information such as free or reduced lunch rates, and academic or graduation statistics. In addition to your school or district data sources, there may be state or national databases that are helpful. Just because you find some existing data does not necessarily mean that you should use it. It's common for existing information to have some limitations, especially when it's being used for a purpose other than was originally intended. It's important to identify these limitations in advance. Make sure you understand what was the purpose of the original data collection? Why was the information collected in the first place? Who collected it? How is it being used? Do some reading related to the background of each information source that you use and consider what kinds of biases may be reflected in the information. How old is the information? Many existing data sources are updated periodically. What is the most recent information available? Does the information still seem relevant given changes that may have taken place in your community since the data were published? How well does the information align with your geographic area of focus? Data may be available at a variety of geographic levels. Most large data sets allow for statewide compilations. Many also include options for reviewing data at smaller geographic levels, such as county, city, neighborhood, or census tract. Some information may be available for a specific facility, such as a school or a hospital. Try to align the information as closely as possible with your actual geography of interest. It would be impossible, for example, to understand a school's population trends based only on statewide data. Who provided the information? Where did the information come from? If it's based on community survey data, how many people participated? Are there any groups that may have been underrepresented in the data collection? For example, was the information collected only in English? Was it collected only using calls to landlines? Depending on the answers to these questions, in some cases, you may decide that the limitations are significant enough that you should avoid that particular data source altogether. In other cases, it may be enough to simply acknowledge the limitations and to be thoughtful in your interpretation. As you are reviewing existing data, engage your team in discussion regarding the data and the key findings that they see. It can be helpful for the team to discuss what they see in terms of trends or changes over time, things that are surprising in the data, the scope of the issues that are identified, potential disparities or inequities across groups of students, and the potential impact of the issues on the broader school or district community. It is likely that existing data will not fully answer all of your key questions. What additional information is needed to help you understand the most pressing needs impacting students at each tier and the extent to which current services or supports are meeting these needs? During the third phase of the needs assessment process, you will prioritize questions that still need to be answered, plan for additional data collection, and gather and analyze new information. Identifying additional data to inform student needs and developing a plan to gather it is another best practice standard promoted by the National Center for School Mental Health. It can be helpful here to do some general brainstorming about what you still want to find out, who can provide that information, and how the information can be gathered. For instance, you may decide that you need more information about how students perceive the overall school climate. Only students themselves can answer this question, and you may decide to do a school-wide survey, for example. Or maybe you want to find out how often students are leaving classrooms due to concerns that may be related to their mental health. This isn't tracked anywhere officially in your school, but it may be possible for some school staff, such as nursing staff or counselors, to track this information for a limited period of time. You may want to know more about how parents view the quality of the mental health services that are available through the schools. You may want to find some opportunities to talk to them directly, such as through focus groups or listening sessions. Information can be collected through a variety of strategies, such as surveys, focus groups, interviews, community meetings, or new tracking processes. There is no one right or best way to collect supplemental information. Each method has different strengths and weaknesses. For example, surveys can be fairly quick and easy to administer online or on paper. However, surveys may not be the best strategy for gathering information from younger children or across a diverse array of students with different cultural or linguistic backgrounds. Surveys also do not provide an opportunity for you to dig deeper into responses to better understand why people answered the way that they did. In contrast, doing a focus group would allow you to ask deeper questions and to gather rich information and insights. However, the results from a single focus group may not represent the full array of perspectives present in your school or district. Focus groups can require more time to organize and conduct, and some participants may not be comfortable sharing their experiences in front of others. What matters most is to select the strategy that will be the most useful in obtaining information from your intended audience and which aligns with the time and resources that you have available for the needs assessment. There are several other best practice standards that should be considered at this stage. It is important to use needs assessment tools and processes that are psychometrically sound and culturally relevant. In selecting needs assessment or data collection tools, consider the following questions. Is the potential tool compatible with the purposes of the needs assessment? Does it have theoretical or empirical support for the psychometric properties? Has it been evaluated for use with students from the cultural and linguistic backgrounds present in your school? Can it be used within the context of the school and the school population? Does it have strong psychometric properties in languages other than English? Does the tool assess social and emotional strengths as well as needs? Does it address social determinants of health and education, such as racism, poverty, social injustice, or food insecurity? Another best practice recommendation is that you pilot your needs assessment with a small group of students, families, and other relevant groups for feedback and revisions before taking on larger scale data collection. This can provide you with the opportunity to test your strategy out and make improvements to your materials or processes before you attempt larger efforts. As you move forward with collecting information, make sure that your project is clearly communicated with your key stakeholders and that you have identified and reduced barriers to participation. To increase the opportunities for broad participation in your assessment, share information about the needs assessment in multiple formats prior to implementation. Engage students and families in consent processes with the opportunity to consent or opt out. And follow up with any students who are not in school when the assessment was complete, such as students who were absent that day. The final step is to share and use the results of the needs assessment. At this point, you will review the full array of information that you collected, discuss the key findings, develop recommendations for implementation, and share findings with your stakeholders. We also recommend some debriefing as a group to document your learnings about what worked well and what you might change in future needs assessments. One challenge in conducting a needs assessment is synthesizing all of the various data and developing conclusions and recommendations based on all of the information. It's important to take a step back to consider what the results mean and assess their implications as objectively as possible. As a team, consider the following questions. What patterns and themes emerge in the results? Are there any findings that are surprising? If so, how do you explain or interpret those findings? What do the results suggest as potential priorities for student mental health or well-being or school-based mental health approaches? What opportunities are emerging for strategic partnership or collaboration? Are there places in which various stakeholders disagreed with one another or presented a different perspective than your own? How can the underlying causes of these differences be explored further? To the extent possible, consider disaggregating your needs assessment results to explore differences within your student body. Disaggregating data involves examining information for different subgroups of students, allowing you to see potential disproportionalities or disparities in the results. Your ability to meaningfully disaggregate data will depend on the size of each of the groups that you are looking at. Depending on your specific school population, you may want to disaggregate data based on race or ethnicity, generational status, immigrant or refugee status, age group, gender identity, grade, geography, sexual orientation, free or reduced lunch status, or insurance status. If you do find disparities across different subgroups of students, be aware that there may be many different factors that contribute to these differences. There may be legitimate differences between groups based on different skills or experiences. However, often differences can be traced to other systemic differences in what students experience or how they are treated. You also need to be aware of your own perspectives and opinions to ensure that you are not inadvertently interpreting differences through a lens of implicit bias. Reasons for differences may vary and can include numerous factors. It can also be worthwhile to reflect on the needs assessment process itself. What worked well? What challenges emerged? What, if anything, could have prevented those challenges? What lessons were learned about how to effectively conduct a needs assessment in your school or district? What recommendations do you have for doing the needs assessment differently in the future? Were the right stakeholders involved in the needs assessment? If you could do it again, would you change the way that you engage stakeholders? Did your data collection strategies yield the desired information? If not, what approaches might have worked better? Are critical stakeholders satisfied with the results of the needs assessment? Do they have feedback that should be addressed in future assessments? Did the needs assessment yield meaningful recommendations for future priorities? If not, what would have helped make the needs assessment more useful? Documenting this information immediately following the needs assessment will help document the lessons learned and can shape future needs assessment activities in your school or district. In most needs assessment processes, one of our goals is to select specific intervention approaches that can be used at one or more tiers. It can be difficult to choose the right approach even after you have identified the needs. You should consider a variety of factors in determining what are the right interventions or approaches to recommend based on your results. Consider criteria such as the cost benefit of services, the feasibility of offering services, the likelihood that an approach will resolve the needs or issues that you saw in the data, alignment with your organizational mission, compatibility with existing efforts, the availability of people with the expertise or training to carry out that strategy, adequacy of resources to implement that strategy, and the possibility for collaboration or relationship building. It can be helpful to be explicit with your team about the process that you will use collectively to review the data and develop recommendations. One possible approach that you could use if it works for your community is to first review criteria for selecting the approaches that you have agreed on and make sure that everyone understands them clearly. Second, discuss the possible approaches in terms of their history of success, their fit with the community context, their appropriateness in relationship to your mission, etc. Third, rate approaches based on the feasibility of implementation and the likelihood of success. Discuss these ratings as a group, considering whether one or more approaches might be consolidated or combined. Fourth, rank order and select priorities using the same method that you use for prioritizing issues. And finally, vote on the approaches to use from those top choices. There are several best practice standards related to the process of developing recommendations. First, identify areas of overlap or misalignment. Are there things that you are currently doing that are redundant or which don't align with the needs that you identified through your assessment? Second, make decisions about how to align services and supports to avoid duplication. Third, reduce or abandon supports and services that are redundant. It's easy to focus on things that you want to grow or expand or add, but it's important to also be thinking about things that maybe you want to discontinue doing or change the way that you are doing them. And finally, develop a team-based process for ensuring that the new initiatives that you bring in complement those that are already in place. As you review your needs assessment findings and your recommendations for action, it can be helpful to create an action plan for using the results. Engage your needs assessment planning team and community partners to consider questions such as, what did you learn about the strengths of your services? Where is there room for improvement? What goals do you have for improving, expanding, or sustaining services? As you identify your goals, consider what it will take to achieve them. Try to identify the steps that will be needed to reach your goals and determine how and when these steps should be taken. Who will be responsible for achieving them? Try to proactively identify the barriers that you might anticipate encountering in reaching your goals. What can you do to reduce those barriers? You do not necessarily need to commit to large-scale changes in your school-based mental health system or services right away. You may want to test out some potential improvement strategies to see how they work. Consider developing a plan to conduct a series of iterative PDSA cycles in which you plan an intervention, implement it for a short period of time, study the results, and act on what you learn from the trial. A final step of the needs assessment process is to share the results with your key stakeholders. There are several important best practice standards here to consider. For a needs assessment to be helpful, the information gathered must be shared and used to inform services and supports. Best practice indicators include developing a comprehensive needs assessment report that is easy to understand and readily accessible to inform decisions, using needs assessment data to inform how gaps can be addressed with existing or new services and supports, and using needs assessment data to prioritize the selection of programs and strategies. You should share your needs assessment results using a variety of strategies. These may be written strategies or information that you share verbally at meetings. Regardless of the format that you use to share results, consider these tips for making sure that the information is shared effectively. Focus on key findings and data that support your important results. Synthesize the most important takeaway points and highlight key pieces of data that support your findings. Consider using bulleted lists, graphs, and charts to present information in a clear and concise way. Clearly describe the limitations of the assessment. There are strengths and limitations associated with all types of data collection approaches, and some information can be challenging to gather and interpret. Be forthcoming about the limitations of your approach so people can interpret the data in the most appropriate context. In this video, I presented a brief overview of how to conduct a needs assessment process to inform your school mental health system. It's likely that you still have questions about this process. This may be an area where you want to get some assistance from someone trained in research and evaluation methods. It's likely that you would need to at least consult with others from your school district. You may also want to consider bringing in a consultant to help. There is a robust community of individuals who provide this type of consultation. You could look for individuals through a local university or reach out to the national or state level evaluation associations to find someone to work with you. I hope that you found this information helpful. To learn more about needs assessment, please feel free to visit our website where we have a number of additional resources available to support your needs assessment efforts. Thank you.